Thank you for a very interesting talk. I'm Tom Moy. I'm just trying to understand whether I've understood you properly. Are you arguing for a tax-less, benefit-less state? And if that's so, then how do we justify a society in the first world compared to societies in the developing world, which have high savings rate, as you want, yet people from the lower strata find it much more difficult for social migration upwards? And then how do we justify our own benefits on HECS and HELP, which all of us have gone through in this room, which are basically interestless loans, which itself is skewing the education market?
Tom, do you want to answer that?
Okay. So just very briefly, I don't think that the example of China or India, if those are the cases you're having in mind, particularly useful models, because these are societies that have only recently been reintroduced to modern market principles. What we have seen is when that happened, hundreds of millions of people were raised from staggering poverty into middle class, identifiable middle class prosperity. It's been the greatest poverty eradication program in the history of the entire human race, and you managed to live through all of it. So this is an enormous transformation. In Asia generally, actually, there tend to be higher savings rates, partly because there's much less culture of dependency on the state. People know that the state is not going to care for us, and so family structure and savings tend to be higher. I don't think that the general claim about lack of social mobility is true overall. We've seen enormous social mobility, but inadequate, because the introduction of the liberal reforms, 1991 in India, 78, and beyond in China, have been spotty. They have not reached out to all of the rural population. So Xinjiang province does not have the same access to the market as the coastal regions in China, and also rural India versus urban India. So these are the questions. I think the better solution is to extend market freedom to wider swaths of the population. But more generally, one can have a state social safety net if it's understood clearly to be a safety net for those who, through some unforeseeable misfortune, fall through the cracks. But that's not what we got. And there are good reasons why these things tend to expand, precisely to capture more of the population to be dependent on it. In the US, very far behind on the means testing question. Why? Because wealthy people don't want to lose their Social Security benefits. It's their PIN money. It's the money they use to pay for their little extras and benefits and so on. That's made it very difficult to reform that system because it was created to be universal. Australia, fortunately, you dodged that bullet to a substantial degree. And so you don't have exactly the same culture that makes it much more difficult to reform. My view on the matter, if you want to have a social safety net, set that out as what is going to be there. If it can be done voluntarily, all the better. But one could say in the last resort, a net is the last thing before you hit the bottom. There would be a net from the government. But let's not create this system that we're seeing ballooning and absorbing more and more of civil society. As last point, Australia is in a much better position than most countries at similar level of economic development. This is the time to get your house in order and avoid sliding down into the condition of the European welfare states.
I've got a question over there.
Just thinking about Adam's pessimism about how things might change, and I suspect Peter might share that pessimism. My perception is that there's a growing culture, if you like, as a result of the superannuation program, that if you have to go on the age pension, it's kind of a sign of failure. You know, I'm in the baby boomer generation, and I discuss it with my peers, and there is a comment quite often lamenting that they haven't got enough, and that it's almost an admission of weakness that they have to resort to the pension, if you like. So I'm wondering whether that same culture could be applied to other aspects, education and health, for example, so that it became recognised that it really was a last resort, as Tom said, and that there is an expectation that you would save for your own education and welfare and so forth, but that if you were a failure, you shrug your shoulders and resign yourself to the fact that that was there. And I wonder, in a practical sense, if means testing is the way to achieve that, or if you think that's not good enough.
I'll throw that one to Peter Saunders first, and then I'll go to Adam and Tom.
Well, I'm ambivalent about means testing. There is scope, as Andrew and I show in our introduction to Tom's book, for further means testing in the Australian welfare system. But means testing is a double-edged sword. It's a problem because it penalises work, because the more you work, the more you earn, the more the benefits are withdrawn from you. And it's a devil's own job to work out a means testing system which doesn't bring in heavy penalties as people, for example, move from part-time to full-time work, or when they do some overtime and so on. So it's an anti-work measure to increase means testing, and it's an anti-savings measure. If you look at the Australian age pension system, the problem with it is that it pays you if you haven't saved. So I'm not ruling out more means testing, but I don't think it's the long-term solution to the problem that Tom is posing to us about how do you get on top of the welfare state. Australia is already a tightly means-tested system, and I don't think there's a lot of scope for further means testing. I do like the idea that there is something in the culture, and I think there is something in the culture about that superannuation is helping to contribute to, of that self-reliance and saving for your old age and so on is something to be commended and is something to feel proud of and so on, and that perhaps we can build on that. As I said in my talk, I think that there's other things, not just retirement pensions, that can be funded through personal savings accounts. But I do think that there's a major political issue that entitlements are very easy to give and extraordinarily difficult to pull back on, even at the margin. I was thinking, as I was trying to think this morning about what I might say this evening, I was thinking about poor old Maggie Thatcher again in Britain, and those 10 years that Thatcher was in power. And I remember people going around with T-shirts saying "Stop the cuts" and cartoons in newspapers of Thatcher with blood all over a hatchet that she was taking to the state. And at the end of 10 years of Thatcher's reign, the state was taking exactly the same proportion of GDP as it was at the start. That all that Thatcher managed to do was to hold it, to stop it growing. And we're seeing the same thing now in Britain under this coalition government, that massive controversy surrounding its attempts to pull back on disability payments, for example, which is something that Australia could do more on. These things that public opinion, 70–75% of public opinion in Britain thinks that the welfare state is being abused. People are willing to see that there's a problem here, but as soon as a government starts doing anything practical about it, politically it just becomes an absolute quagmire.
Adam, do you want to?
I'll just make a brief comment. Yeah, the higher education contribution scheme was mentioned earlier, and I think that I mean, although it might be flawed in some ways, it provides a very good model that could be used maybe to bring some market forces into the health system, which is still kind of a universal system. Maybe people could, borrow for their health needs, and it could all be financed. It could be provided privately, so the government could try to withdraw itself from more of the health system, and people could have similar loans, and then when they're earning a certain amount, they can pay it back. I think that provides a really good framework, maybe of a kind of a relatively modest measure. Just on the superannuation system, I'm not as keen on it as Peter. I mean, he's obviously done a lot more work on it than me, but I just think that very few people pay any attention to their superannuation balance, and that's largely a function of the way it's presented, I suppose. Their balance comes at odd times. It's not presented on their salary slip, and so therefore the fees in the system are enormous, and it's a gigantic subsidy to the financial services industry. And that concerns me, and I think that the poor or less informed people end up paying more fees than the people who are better informed. And because the system as we have it is not well aligned at all with the old age pension system, it's hopelessly abused, and it's not a substitute, unfortunately. It should be, and of course Frederick Hayek was all for compulsory saving. But as long as it was a replacement for the public pension, but the problem in Australia is super is not a replacement at all, in fact. And this is completely overlooked, but the Henry Review said that if you lift the rate of compulsory superannuation from 9 to 12, it is actually a net cost to the government. The net cost, it is not a hard-nosed measure to shore up the public purse. It is a cost because the lost income tax revenue foregone is much greater than the reduction in the old age pension cost. And that is because you can still get the old age pension if you have $1 million and 86,000. If a couple has $1 million, they can still get the old age pension. Now surely that's ridiculous. And of course, there's no test at all on the home, nothing. You live in a $20 million house and get the old age pension.
Just a very quick point there. This means testing issue is a serious problem, and especially my experience in education. Many years ago, I had a small financial windfall, and so I put all the money aside for my nieces and nephews to pay for their education. And I found that later, when they grew up and went to college, there was a dollar for dollar reduction in their student aid. Oh, okay, I won't do that again. So I put aside money, and then that just reduced their eligibility for scholarships. And this is really very perverse system. People who don't spend their money on a European vacation or a boat are penalized, in effect, for saving instead. That can't be right. What we do need to do is think more creatively about financing of higher education, because there's a substantial premium so long as you don't go into cultural studies or something like that. There's a big premium to having a college or university or technical education. And that means a higher income stream in the future. People should be expected to pay out of that. Instead of the system that sees it as an entitlement, which really means poor people are paying for the college degrees of the wealthy. That is the reality and the fact of the matter, and that is clearly unjustifiable. And when you bring it to the Labour Party and put their nose in it, they're at least embarrassed about the fact.
Okay, we've got questions everywhere.
Thank you very much. It's Andrew Wakeling. Surely in Australia we have plenty of time to tune this system. It must be important that we deal with gaining as much political consensus as possible. Although I find your presentation fascinating, we are not sliding towards Greece, nor are we, in Tony Abbott's terms, we do not have shades of Cyprus where 60% of bank balances are being taken. There's plenty to do. The CIS in sponsoring the work in trying to get government expenditure down in 30% is not, as I understand it, taking an approach of saying we must drive the social welfare state out. And I think it would be a grave mistake if we did. Is it not really important that we take into account the political situation that we have? We concentrate our attention on difficult things like getting the House into the assets and income test for superannuation, a major, major problem that we have, which is causing there to be a large number of very large houses with old people who can't use the rooms, and their kids are living in tiny flats. That we actually look at this disability scheme, which looks to be very ambitious and easy to promote, but we've got to be worried about about whether it's sustainable. I really worry when you say that our system is unsustainable. If we want to, there is no reason why we should not continue to look after the poor and the sick. It's important that there is a democratic consensus for that. We will need to adjust the payments that are made. If we cannot afford to provide care for the sick in intensive care units until they're 95, then we can't do it whether we pay for it through savings accounts or through taxation. We'll have to adjust. I'm a refugee from the UK. I think it's wonderful that we have the opportunities here. Do you agree?
Tom, I'll throw
Oh
that
yeah,
one
no,
to
I'd be happy to. I encourage you to read the chapter on Italy by Pierluigi Falasca. And what happened in Italy? They had a robustly growing economy, young population in the 1950s. They had a government that swept away all of the fascist legislation, and they had the sweet life that was developed at that time. Unheard unheard of prosperity in Italy. And it was in the 1960s that people began to say, well, surely we can afford these various programs. Well, now we're not in the 1960s anymore. And Italy has an aging population and is unable to fulfill those promises. It matters to look 50 years into the future. And my fear is that if Australians are not thinking over that time horizon, making these hard choices, and you've identified some, there are others in Peter and Andrew's introduction to the book that are practical, reasonable things. If you don't address those problems, you are likely to find yourself in Italy's position sooner than your grandchildren think. And that's what we should be thinking about here. So I don't want to say that Australia is collapsing or this chicken little situation. You're really in a very enviable position to be able to make those kinds of hard choices. But I think you need to start doing it now and not thinking, well, it's not a crisis, so let's put that off to the next generation. And they can put it off to the next one, and then it'll be too late. You do have also a graying population, like many advanced countries in the world. You're better off than most of the European countries because this is a more open opportunity society. People are coming from Asia and elsewhere to UK to make new lives here. And so that gives you an advantage like the US has in this regard as well. But this is the chance to begin to make those hard choices and not to put it off.
Peter, do you have a comment on that one? Sorry, Peter Saunders? Lost sound.
Yeah.
Oh, yeah.
I would agree with what the questioner said as regards the importance of trying to maintain some degree of political consensus. I think that if we find ourselves in a position of appearing to be just hard-edged, hard-nosed destroyers of the welfare system, then you're not going to carry public opinion with you. I think in the most recent thing that I wrote for CIS, I tried to talk about these two strong instincts that compete with each other in discussions about welfare. And one is this compassionate instinct, which everybody feels. And it's what the gentleman said, the questioner said when he said, surely we can afford and we should support the poor and the weak and so on. Everybody feels that. 99% of the population would agree with that. And for us to set up a reform agenda that says, well, actually, we're going to withdraw that support, I think would be ridiculous. It would get us nowhere, and it's not right. Anyway, the compassionate instinct is one that has to be listened to. But there's also a fairness instinct, and it's that I think increasingly, certainly I see in Britain where I'm now living, that people feel, hang on, but we're being ripped off by this, that there's a lot of abuse of the system, that the benefits are escalating. In Australia too, disability is an area that I think Australia could and should get hold of far more radically than it has done. There's the blowout in the number of people on disability disability pension in Australia has been extraordinary over the last 30, 40 years. In Britain, they're reassessing everybody on disability payments. And what they're finding is 30, 40, 50% of the people who have been on disability payments are capable of working. They should not be on those payments. And you carry public opinion with you when you do that sort of thing, because people don't like the idea they're being ripped off. People want the welfare state to support those who need help and who genuinely can't help themselves. But they don't want it to be a sort of general trough for everybody to stick their noses in. And I think there is a sense that that's what it's become.
Tom Palmer.
Can I add just a very quick point? There are models that have avoided exactly the issue you're raising about a polarization in society, us and them. That is not healthy for the society and will not be successful. Canada is a good example. They began reforming a much more extensive welfare state in the 1990s, and this is under governments of the left. For the NDP, which is the more extreme left party on the provincial level, then the Liberals under Jean Chrétien and Paul Martin began to say, we can't afford this. They really began to hit the wall. And now under Harper and the Conservatives. So there was a general consensus across the political parties because there was an adult conversation about what was affordable and what was not. Germany is seeing a similar discussion among the Social Democrats, the Christian Democrats, and the Liberals. And you're finding that it's possible to do that. Canada has dramatically, they're not as far as they should be, they have dramatically reduced the scope of this and the net indebtedness of the state. They're doing something unheard of. They're paying off the national debt. So this can be done in a way that brings in the center left and the center right for a grown-up adult discussion.
We have time for one more question. Gentleman up the back there.
Just on the point of opting out of the welfare state, I seem to remember, yes, I am that old, that when my father many years ago paid very high private school fees, I did have a public education for a few years, then private school. The private school fees, I think, then were a tax deduction. So whatever your prevailing rate of income and percentage, could we not also apply this to medical insurance? Currently, I pay about $1,000 a year for private insurance. Even unemployment, you know, if I were to set up a specialised account similar to a superannuation account, specifically for unemployment, let's say $1,000 a year, round sum, just call that a tax deduction. You don't have to go through all the complexities of means testing and all the argy-bargy of someone being on the right or the wrong side of the means test or the marginals. It would also mean that a lot of people now for whom private education is impossible, with the tax deduction, it brings it, the marginal parents can actually give their kids a private education, private health cover and unemployment relief. Would that be some way, a sort of a soft way into getting out of the social security system? Thank you very much.
I'll throw that one to Peter Saunders first.
Absolutely, I couldn't have put it better myself. I think to enable people to opt themselves out, rather than to turn around to people and say, we are coercively shutting you out, or we're coercively shutting the system down. I'm certain that that's the way to go. It's carrots and not sticks. And I can't say it any better than you said it. This is the essence of what I've tried to argue in a number of the papers that I produced at CIS from about 2005 to 2008 about personal future funds, about voluntary opt-outs, tax deductions as trade-offs for giving up your rights to various welfare benefits. I'm sure, I'm not an economist, and it may be that when people who are familiar with the public finances get hold of this, they'll say it's not viable or certain things can't be done. But as a broad principle of the way forward, I think it's very attractive. I think you'll carry people with you on it.
Adam, do you want to?
Yeah, just a really quick point. I think it is a much better structure for doing things, being able to offset, say, the cost of children against your tax to some extent, and indeed that's the way it was done. But I think the only problem now is so few people work. We're a society, you know, the population of 22 million people, there are just under 12 million people in the labour force, and about 9 million people have a full-time job. So there are just very few people working. So there are just so many people who are dependent on government for a fair part of their income, or at least government services, that all those people suddenly wouldn't, you know, they just don't have any income to write off things against. So that's the only problem with it.
It might set up a momentum effect, though.
Yeah, indeed.
Tom Palmer.
I'd like to raise a note of caution about that. I think one of the big problems in healthcare in the United States is the deductibility of insurance. It's a non-taxed benefit. This goes back to World War II, when, to avoid the wage controls, which were a foolish measure in the war, companies couldn't pay a higher wage to attract you to a munitions factory, so they gave you an insurance policy. It was ruled not a violation of the wage controls. Then they said, is it a wage? Well, it can't be. It wasn't a wage rise, so it's non-taxed. The consequences over time, everyone gets their insurance through their employer, and you have a third-party payment system that is driving healthcare costs through the roof, because I don't save any money by shopping around and getting the better deal. In the introduction to this book, the HSA that's proposed, and I presume similar to the American Health Savings Account, is a much better system of doing that, in which you put aside the money, it's deductible from taxable income, and if you don't spend it on whatever it is, health care or something else, it does accumulate for your old age. I found when I went to an HSA, I became a much more alert shopper. And I saved on one MRI. I had a magnetic resonance imaging for some terrible headaches I had. The doctor gave me this. We'd like to do some tests, which means I worry you have brain cancer. I didn't, fortunately. And she said, go to this clinic. And I called. How much is that? Oh, don't worry, it's insurance. I said, well, how much is it? I was shocked. So I called around. I got $800 less by doing some calling around. So this system should be combined with an alertness to the incentives that it creates. We want people to act as cost-conscious customers, and under the welfare state, they don't do that. They just look typically for whatever benefit is available, the best. And also under certain kinds of deductibility, you diminish the incentive to be a cost-conscious shopper. So that's something, just when creating such a system, be very alert of the incentives it creates for consumers.